Hello, everyone. Thanks for joining our webinar hosted by HealthRecon Connect. Today's webinar is regarding sustaining a healthy revenue cycle. I'm Clint Owen, VP of Enterprise Sales for HealthRecon Connect. HealthRecon Connect, just real briefly, is a boutique concierge type service offering of end-to-end revenue cycle services. And we'll get into more of that as we get into the discussion. Joining me today is Kari Cornicelli and Sheila Augustine. Both of these ladies are highly sought after presenters within HFMA, both regionally and at national conferences. Just a quick little background on both before we get into the presentation. Kari is currently president and CEO of KSC Consulting. She has over 30 years in healthcare, serving 22 years at Sharp Health in San Diego and 3 years at one of the largest pediatric health systems in the country, Phoenix Children's, as CFO. She has a passion for ensuring financial integrity, developing sustainable financial systems, and building best-of-class teams. Kari has also been an active member of HFMA, serving at the local, regional, and national level, and she has served as National HFMA Board of Directors and is past national chair. Quick little update on Sheila. Sheila is joining us from Nebraska Medicine. She is the Director of Revenue Cycle. She started at Nebraska Medicine in 2005 within the patient financial services area. In 2008, she started a journey within Nebraska Medicine that took her into decision support, then into education coordinator positions, and in 2010 was promoted to the operations manager of PFS. And in 2014, Nebraska Medical and UNMC physicians consolidated to form what is now known as Nebraska Medicine. Sheila was promoted to director of PFS. She holds a master's in healthcare administration from Clarkson College in December of 2019. Sheila also is passionate about giving back and serves within her local HFMA chapter as a valued leader. Before I get into kind of the brief overview of the agenda, I just want to kind of remind the people that are attending is, if you have any questions, put them up in the chat box and we will address them accordingly throughout the presentation. Also, at the conclusion, please take a few minutes to fill out a short survey. We'd like to know what your thoughts are on any kind of improvements and or subject matters that you would like to hear in the near future. Also, the recording will be available through our social media pages within the next couple of weeks. And so keep an eye out for that. So with that, let me kind of go through the PowerPoint here it's a small PowerPoint. This panel and the way we set this up was not to bore you with a bunch of slides, but it was really kind of, when we look at healthcare, there's so many things we can talk about, as we all know, but we kind of highlighted some really important things that are really affecting healthcare today. So the agenda is set up in this order: employee engagement and retention, patient engagement, automation, usage of AI, and how to identify the biggest bang in that utilization, payer management. And then we kind of threw in a caveat here of cash is king, and that goes way back to when I got in healthcare. But so we want to get a CFO and Rev Cycle perspective on what it means that be cash is king within the hospital setting. And then we'll wrap up with what are some of your viable options, short-term and long-term options, when it comes to potential needs for outsourcing. So again, the high level, that's what we're talking about. To kind of kick us off, I kind of like to lay a foundation of where we're at. I mean, everybody knows since COVID hit, we've had a major issue of staffing shortages. How are we addressing that? And as I presented at another conference a few months back in the fall of last year, did the pandemic cause it? So these are things we want to kind of look at. And let me get my slide to move here, hopefully. Hopefully y'all can see that. So I've got a slide up here for everybody that hopefully can see it. Is back in 2013, the World Health Organization predicted there would be a 12.9 million healthcare shortage globally by 2035. And in fact, by 2013, the number was already at 7.2 million. So we have surpassed that in many ways. Of course, this graphic really kind of talks about from the physician and nursing standpoint. But as we all know, through the pandemic, we have encapsulated a lot more shortages within non-clinical. It's brought about shortage staffages in a lot of administrative roles within finance, within revenue cycle. So these are some things we kind of want to address. So with that, I want to open up the conversation to the ladies. Give me your immediate thoughts and opinions about what what this graphic kind of talks about, and then also kind of encapsulate that with what are you seeing where you were, Kari, and Sheila, where you're at regarding employee loss of employee short staffing, and let's get into how we're going to resolve or mitigate the shortage and talk about how we retain. So let's get into that. Kari, would you start us off?
Oh, you want me to start? Okay. We need to create a dynamic workplace that values the contribution of every employee. That's the bottom line if we want to compete and keep our employees engaged. And that all starts with creating a culture that people want to be a part of. So that culture should be based on mutual respect, fair pay and fair treatment of employees, and clear and open communication. I think those are minimum standards in creating a good culture. We need to follow that up with providing our staff with adequate training and defined expectations for their performance. We also have to have an environment that has reward and recognition of the staff. We need to allow our employees to work on cross-functional teams that give them interaction with their broader organization and give them opportunities for growth. So all of this, none of this happens on accident. We really have to be focused on creating a dynamic workplace that values the contributions of each and every employee. So that's where I stand on employee engagement.
Yeah, what are your thoughts though on some of this prediction that the World Health Organization kind of put out there? Did this resonate with you? Does this surprise you?
No, I think it mimics where we are in society today.
Yeah. Sheila, what about some of your input regarding this?
Yeah, so I was actually kind of glad Kari had actually talked about training as well. I think to keep people motivated, if you listen to individuals when they come out of the training, are they really, really ready to do their job? Do they feel like they have all the tools necessary? And really listening to that feedback to take it back. At Nebraska Medicine, we have an administrative area that does all of our training for our Rev Cycle employees. And so as a leader, it's really important to take that feedback when they come out of training back to our training team and say, maybe they didn't feel ready right here, because that is the beginning of how they're going to start their journey throughout the organization they're going to work for. And if they're not engaged at the point of starting within training, they're not going to be engaged long term and stay with you. I would definitely agree with Kari, being competitive, showing reward and recognition. What can you do? And when we don't really always want to talk about pre-pandemic and now what are we doing after, but the reality is some of us used work from home as a motivator for rewards and recognition, and that's kind of just a standard now. So now what do you do to reward and recognize? For us, we used to reward and recognize with jeans, and now people are at home in their pajama pants. So it's really hard. How do you keep that going? But I think the competitiveness, looking at what you can do differently, maybe how can you offer different hours to keep people motivated, working around their family life. It's such a different dynamic. And I don't know that there's a right answer, but there's so many different things that you can do to keep them motivated.
Well, and great points, and something that I always lean on whenever, I've gone through some of my transition within employment is, how much does culture, having a culture, the right culture, how much does that drive into it's kind of a rhetorical question, but into the employee engagement and retention? Sheila, can you kind of expand on that a little bit?
So for me, I look to Kari too, because being a chief, it starts from the top down, creating that culture. And so from a leader, from my perspective, I'm looking up to making sure that culture is being created from the top down so that I can continue creating that culture for my employees. I think open, honesty, transparency is all very important. And I like to start off my team meetings and when I meet new employees talking about being transparent. Sometimes people don't like that, but I think they respect it because they know that they're going to get the information that they want.
You know, adding to that, then we could move into the next question if we want, but a good culture doesn't just happen by accident. You have to be very purposeful in creating it. And the challenge with that is that you can create a great culture, and Sheila and I can be great leaders, but if we have leaders under us who aren't strong leaders, we have inconsistencies in the way they practice, their training habits or lack of training, etc. All of that also impacts the culture. So we really have to make sure that it's really top down, the expectation and the type of culture you want of mutual respect and fair treatment and open communication and transparency, that all of our leaders embrace those standards, not just Sheila and I.
Yeah, no, great points. It starts with at the leadership level, but I think when you have the proper culture in place, and it has that, what I call that trickle down effect, and you get all the frontline staff to buy into what that culture is, it certainly helps within that framework. You mentioned before about we're talking about teams, we're talking about employees and retention. We all are set to and have accountability KPI set to us. And as an employee, how do you make your team accountable to keep them? I mean, I think accountability helps kind of keep the retention, keeping your teams accountable. Okay, and get this part of that team to buy in. How do you do that?
You're breaking up a little bit again. I'm not sure why. But how do we keep our teams accountable? Was that the question, or our leaders? I think that all of our organizations do employee opinion survey, and we all get feedback on turnover, etc. And I can tell you the one area that I can consistently review and get great feedback in, unfortunately, is in my employee turnover statistics and my comments. And they always lead me back to, I had a leader issue or a training issue. And that is back to, Sheila and I have both said that over and over. We need to be in tune with what's going on in our organizations through daily rounding. On the face-to-face, we need to have an expectation of our leaders to be rounding, to be following up on their questions and concerns and giving them feedback. And using that information, we need to be, for our remote workers, we need to be doing also rounding with one-on-ones weekly with staff and daily check-ins with the entire team, things like that. But it all comes back to communication. And if you aren't doing that rounding and you aren't reading the information that's coming back to you, either through employee engagement surveys or through turnover information, then you aren't going to know what's going on. So knowledge is first. First-hand knowledge is the first thing, and then the second thing is acting on it.
Surveys. Detail from a hospital provider perspective.
Hey, Clint, I think you're cutting out really bad, but I'm going to piggyback off of a little bit of what Kari said for, making sure your staff definitely agree with the rounding and one-on-ones. One thing too that I like to do as well is make sure they understand how they impact the revenue cycle. What do they do? How does their specific role impact the numbers? What can they do to make a change? And I think that's super important. I mean, many places I've heard over the years do have like incentivize their staff with bonuses, maybe on point of service collections. We are unfortunately not there yet, but it really helps them to understand how they impact, because it's great to say our AR days are 44, 42, but what do they do? How do they impact it? What makes it so important so they don't feel like they're a widget just working accounts out of a work queue or registering a patient? How do they impact the overall numbers? And I think the more that you involve them in that, the more they'll ask questions and what can they do to actually help those numbers.
I agree.
Different verbiage and colors to the comments, absolutely. So, technology to really make it more productive and meet your expectations. Stop looking at the technology that you're used or using to control and review.
So Clint, because you're breaking up so much and we can't quite hear your questions, I don't know if you want to click out of your or change your go into mute and then see if you need to use a different microphone or something, but you're breaking up really badly. But I think you were asking us about how we can use technology to improve both the work environment, the culture, and the revenue cycle. Is that kind of where you were going with that? Okay. Okay, so, you know, I think technology is a key part of the revenue cycle, and our employees can help us in that partnership that Sheila talked about of asking them questions of what can be improved and how do we improve it. I think there's two things as leaders that we can do. One is that partnership with our employees and giving our staff the autonomy to make decisions about their daily work process, valuing their feedback, their collaboration in the problem-solving process. But I also think as leaders that we need to audit our technology, and we need to look at how we can improve our work tools that our employees are using. How can we eliminate unnecessary work processes? We need to create, in today's environment, we need to create that digital strategy. That's where we need to start. We need to understand each of our technologies. Have they been implemented correctly? Are they being fully used? Are they just weak tools? And from that, make decisions on what we need to either change or replace or do better training on. But all of the work tools, there's only two ways to change productivity in the revenue cycle, and that's through having a great culture and people engaged in doing their work, and then giving them the right tools to do their work. And we need to be working with our employees and with our IT infrastructure and with our leaders to identify what do we need to change, and creating that digital strategy to roll out the right infrastructure for the organization.
I'm really happy that you said some of that, Kari, because one of the things that it's probably been about 8 months, just doing some rounding on our front end staff in registration, who we know is not at home. They're up front, still checking in the patients. I sat with an individual once and I said, why does that pop-up come up? And she said, I don't know, it always has. And I said, well, what do you do? She's like, it's a referral. And I said, oh, okay. Like, what do you do? She's like, I click the button. And if I forget to click the button, I don't check the patient in. And this has been a referral warning we've had on for 10 years, and it's not needed. It's, you know, taking the time, and it's a click of a button, but those individuals sometimes don't know what to ask, and they're literally just doing exactly what we've told them to do. And we have never taken the time as a leader to kind of audit our own process. And for us, you know, we're on Epic. It's great. Yes. But are there issues? Did we build everything out right? No. And these are the people that understand it like the back of their hand, but they might not know all the answers as to why. And so really listening to them and having them tell you their ideas of what can work better, because they know it, they live it every single day. So I'm super excited you said that, Kari.
You know, it's all about, again, it's creating that culture that values their discovery, values their input, gives them permission to ask questions, to challenge the status quo, gives them permission, and, you know, quit brainstorming instead of question storm. Why is this way? How can we change it? Support their observation and networking, allow them to experiment, connect the unconnected, and then fix it. And some organizations, even like above, they've been told it's always been this way. We're not going to make any changes. We can't do this. It takes too much time, too much resources. As leaders, we need to step in and prioritize what is really impacting the productivity and the ability of staff to easily do their jobs, and then work with our IT teams and our infrastructure within the organization to make the changes that make their jobs easier. All of that is part of, both culture, and it's part of having the right tools to do the job.
Absolutely. Clint, I don't know if you switched to a different mic. We can't hear you.
Technology is great when it works, right?
No.
Everything was fine until 10 minutes before we got started here, but
Now it's fine. Now we
It's
can hear you.
perfect. Whatever you did.
all right. So last question regarding employee engagement and retention. So as we all know, a lot of teams have moved remotely. Y'all said everything you've said, how do you manage a remote staff? And if you have remote staff, are you looking to migrate them back to the four walls? Give me a little bit of snippet, Kari, about your thought process and monitoring and dealing with everything as a remote workforce, as well as you, Sheila, after Kari.
Well, it's funny that you start with me, because I've always, for years and years, I've had finance teams say, hey, we can work remote. Everything we do is on our computer. I'm like, how do I monitor productivity, et cetera? And obviously the pandemic instituted a new normal, and me being forced to work at home myself, realized that, working at home is viable as long as your employees have the tools and you set the expectations. And in fact, you can actually improve productivity in many cases. So I don't see many organizations, I would say most organizations, where they can keep a remote staff and eliminate that office space, if you will. They probably will. It's a desirable work option for many, many employees. It also gives you a more global approach to employee recruitment. But there are some things that will just never be remote. They're going to be face-to-face. You're always going to need someone face-to-face in a registration process, or in a financial counseling, where virtual financial counseling isn't enough. You have complex care and you need to, go a little bit further. And in those situations, you're going to stay in a face-to-face environment. But Sheila talked about it. You've got to find ways to keep your employees engaged on a remote basis. And I do think it's possible. I've watched it work in my own organizations, and been very proud of the dedication of my teams to making it work, with routine meetings and daily check-ins, and still doing those employee luncheons virtually, with sending coupons home, order your lunch and we're going to play games in this half hour and get to know each other, newsletters, whatever it takes. It's a very viable option, and I don't see it going away.
I definitely don't see it going away. We are looking some areas within the revenue cycle a little bit, bringing some back in just from a hybrid model, if you will. However, I will say, maybe we took for granted when we were all in the office, just by saying, hello, Kari, how are you today? That meant you were checking in on me. And maybe we really weren't. It was just more of like the normal, hi, how are you? Good morning. I think now we're more conscious about checking in on our employees. Like, how are you? Really, how are you today? And seeing that in writing on Teams or Zooms or emails. And I feel like that really does keep them engaged. Productivity wise, I would definitely agree with Kari. We have seen productivity go up in many cases, because you don't have the water cooler talk. You don't have, I went to the restroom and I got stopped for 10 minutes. You just don't have that. And I really do think that companies are going to stay that way. I'm looking forward to, for our organization, hiring from other states as well, because we are not there at an organization level. So we're really still focused on Nebraska and Iowa. But I think our recruiting, and as we'll probably talk about a little later with staff shortages, we have to think outside of the box. How do we recruit and how do we retain, especially, I'm in Nebraska. If it's snowing, I'd rather be in Florida, and I would rather work from there. But how do we do that? And how do we continue the productivity? As long as we give them the tools, our staff will step up and they will show the productivity. And because they don't want to come back either. They want to stay at home. They want to be in their pajamas. Now we lost you, Clint. I think while he's figuring that out, Kari, what do you think? Where does patient engagement start?
Yeah, let's go for it. You want to start on that one?
Yeah, absolutely. I think when I look back years ago about patient engagement and just quality of care, I always just truly thought of me sitting there with my provider, never all the other pieces that get involved. And really, where does the engagement start? It's all over. And it's within the revenue cycle specifically, it's that first point of contact, registration, making that appointment. How easy is it to get in? What am I going to expect? We start talking about the No Surprise Act. I want to know how much I have to pay for this visit. I want to know upfront, am I in network? Am I out of network? And I think having your staff be equipped and understand some of those questions that people will ask, a lot of role playing, just so that the patients can feel that they get an answer. Go ahead, Kari.
No, I agree. You know, as soon as the patient enters the system, if it isn't every touch point isn't really clear, efficient, and mission aligned, you have a chance to erode trust with them. And that's before they ever even get to their provider. So we know that the patient experience starts with us. And I think, Clint, one of your questions was going to be, is a self-service process viable? Should we go to entirely self-service, e-appointments, e-check-in, et cetera? And, you know, well, I say yes, it is very viable. It's not entirely viable and going to happen. You're going to have patients that can't adopt the technologies. My mom, for instance, she's never going to try to do an e-appointment or e-check-in. She struggles with technology. So we're always going to have to help our elderly who aren't, as fluent with technology as we are today. I think some patients don't have access to tools, so that's going to limit them in their ability to use their cell phone, computer, or lack of Wi-Fi to make an appointment if that's the only option. We have to make sure we have interoperability between our systems and that we don't have apps and tools that don't work efficiently. And then we have to have interoperability as it relates to that whole pre-auth process or verification of benefits. One app, you've seen a payer, one size doesn't fit all. But with all of that, I think self-service gets us there. It helps us provide electronic tools to a patient. They can understand and hopefully get that virtual financial counseling, that transparency of their charges, of what their expected payment is, et cetera. And that's where we need to go. And I think that's going to help enhance our patient engagement, but it's not going to be a full replacement of it.
Yeah.
So,
can you hear me now? Am I back?
Yep, you're back.
Yeah, sorry about that. Yeah, great points, and I appreciate you taking over for that conversation. I think we keep reading again. I keep talking about things I read and every day, but we seem to be trying to make this as service friendly as possible and let the patient drive the process. And to your point, I think you can to a point, but you can't entirely because of the age brackets and different outlying circumstances that each individual may have. But at the end of the day, we still have to have frontline people to have that communication, that face-to-face, but touch that patient and welcome them, walk them through the process. Because hey, I'm a consumer at the end of the day. And, I've got a question on here about, how do we communicate and help that patient from talking about charges, EOBs? What are y'all doing? Sheila, what are you doing at the front line to help the patient through that process?
It's really it kind of comes down to, again, educating our staff. I mean, let's go back a little bit and think about when high deductible plans came out. How many people really understood that? And even in healthcare, how many people really understood what a high deductible plan is? Because I know I got an EOB once and I called and questioned it, and I thought I was getting schooled, and I thought I knew all about it, and I got schooled by the insurance company. So I really think it comes down to educating your staff and having them understand what an EOB is. What is coinsurance? What is copay? What is a deductible? Because it's great to be able to create an estimate, but as the patient that maybe isn't used to coming to healthcare very often, they're going to ask questions and they want an answer right then and there. And so we do a lot of that in training, and that's even with our medical receptionists, our patient access associates. And I mean, I'm sure with Kari too, I think of myself, my whole neighborhood, nobody will pay a bill or anything until they have me look at their EOB because they don't understand it. And so just trying to educate people, but everything continues to change. And so staying on top of that, I think, is one of the most important things too.
Kari, you have anything to add to that?
No, I think there's still two paths forward, and our path of making sure that our staff are trained on the front end to have that compassionate conversation and share the information that they need. The reality is 56% of our patients now have high deductible plans, or 56% of the private sector, private commercial, have high deductible plans. And we're going to have to be there face to face and help them. But I think the other place, because of staff shortages, if you're rounding this back, is also having the right tools in place for those that are computer savvy and know how to use those tools, that we really offer that tool that gives them that virtual financial counseling that allows them to see expected payment and all of the information they need. It's a combination of strategies where it's like one foot on the boat and the other one on the dock, and the boat's leaving. You know, you've got to be able to do both things very, very well, but the boat is leaving and we're moving to where we're going to need to deploy electronic strategies to help us be successful. 24% of our denials start at the front of the registration process with inaccuracy in names, birth, insurance plan, etc. And we've got to use technology and people to get all of this right. So I think, it's an interesting time that digital strategy is really important for an organization to be able to be successful in meeting patient needs and getting bills out the door and cash back in.
And
you both have hit on it. Financial compassion, right? I mean, you're dealing with a various wide range of age brackets and understanding of just healthcare in general. So I think it takes a very stirred-minded person up front as you're engaging that patient to walk them through those steps. Sheila, go ahead. I cut you off.
Oh, no, that's okay. I was also going to share trying to have anything on your website. So like Kari was saying, if people are tech savvy or, they just like to go find information, having any material on your websites, maybe under your billing and assistance on, your www.nebraskamed.com, how to read an EOB, what does things mean, so that maybe they can go look that up themselves as well. I think that that's very helpful. And any information that virtual financial counseling is great. It's something that we are continuing to adopt more and more, but having them be able to get to that and making sure they understand how to get to that, having that maybe on your website where they can schedule an appointment themselves with a financial counselor.
So you mentioned the virtual counseling. So when you bring that up, are you talking about, is that an outsourced partner, or is that the deployment of AI, which is one of our next topics?
It could be both.
Yeah.
Yes.
Definitely can be both. I would say right now for us at Nebraska Medicine, it is internal. So the patient can actually schedule an appointment with a counselor. So two ways: they can schedule an in-person so that we make sure the counselor is available, or schedule them to be virtual, and then it will send the patient a Zoom. And it can be, I will tell you, there's been some issues with that, because when you're creating those things, it's very similar to telehealth, creating that within Epic for us. And we didn't realize we had our billing address as the address for the patient to come physically meet a counselor. So they were kind of walking all around, and they could schedule at any time. So maybe they wanted to talk to a counselor at midnight. Well, we don't have counselors at midnight, but it's definitely been something great. And it kind of alleviates those patients maybe who drive for an hour or 2 hours for their appointment and then really don't have the time to stop and meet with a counselor before or after, so that they can talk to them before they even present.
It makes sense. And again, I know technology is driving a lot of things that we do, and kind of to finish up on this patient engagement piece, we're talking about all the self-serving and the patient driving their process. I put up, for those that can see the slide, I've got this depiction of a patient on an operating table and assisting the surgeon on the surgery. And I know it's meant to be funny, and I hope you all take that in the vein that it's meant to be. But certainly, I know we're not going to that level. But someone threw that out there, and I picked it up. But anyway, I thought it was helpful to use. So the AI segment. It's just over the last 3 years.
Hey, Clint, you're cutting out again. It's going really choppy.
Yeah, I've been out there in this space for years, and this didn't want it. This AI leading to you using these and empowering and utilizing it today with your workflows.
I think your question, sorry, you were cutting out bad, and Kari, if you heard something different. So I think it's really, is AI the future of healthcare revenue cycle? I would say yes, and I would say no. I think it's a mixture of both. There's a lot of opportunity for AI within the revenue cycle. And when we say AI, I really like to envision AI as something that somebody doesn't have to click a button. And so I think while it's really great to say you can do AI on all these things, if somebody still has to click a button, it's not fully automated. It's not artificial intelligence. I do definitely think there's opportunity front end, definitely middle, definitely back end. I think it's happening. I think more and more companies are coming out as business partners that they have the AI capability and how it can leverage. For me personally, I'm a proponent of automated authorizations. I would prefer my staff don't have to call and check websites on authorizations. If we have an opportunity to feed that information back into our system and not have staff doing that, and let's have them focus or repurpose them on other things that we really need. I definitely think it is the wave of the future. I just don't know that it's not going to solve every issue. And Kari, I'll pass it over to you.
Yeah, no, I agree. It's not going to solve all of our issues. I mean, let's face it, we have antiquated revenue cycle systems and processes, and we've built inefficient processes on our systems over the years. And how do you know to where even to start? I think I had mentioned earlier, you really need a digital strategy, because the reality is we can't keep throwing people at problems, and we've got to build sustainable solutions. And that's going to be through that digital strategy, starting with a digital front door and identifying, where does it make sense? Like you talked, and prior auth is a great place to start. But I think it's important, again, as leaders, for us to do that deeper dive, to really understand what our problems are. For instance, our payer pattern challenges, our revenue risks, our root causes of some of the problems that are causing delays in payment and denials, and then evaluating our systems so that we can see, what systems are creating challenges to our problems, what systems are available to help us overcome some of our challenges, and then creating a strategy to blend both of those. And I can tell you, working with technology over the last 25 years, and sometimes we have the best systems and technology in places, and in other parts of our revenue cycle, we don't. And so you really need to be able to do an evaluation of our tools and resources, and then create a plan of what's most important to replace and why. Where can we go digital using, bots or or AI, like in coding, we did that, 10 or more years ago. We said, okay, coding's changing. We can't keep coding the way we've always done it. And, with natural language processing and coding, we are able to take the EHR and produce codes and now have coders validating, right? And ensuring that we've made the right assumptions. We need to do that with our revenues, the rest of our revenue cycle processes as well. And with anything where you can replace manual work, have rule-based thinking, error-prone work, all of those types of things are great candidates for implementing a new digital type of technology, regardless of what it is. So.
And sorry, Clint, I'm gonna cut you off.
No,
Kari, do you think,
please,
I think back to looking our first one, employee engagement, how do you take the time to be engaged with your employees, knowing that, hey, I'm always putting a 25 modifier on this same thing I'm doing? It's kind of like your redundancy. And so just curious, Kari, if you ever, saw that in your role, is that the opportunity then to keep employees engaged as part of it? But then let me also throw in and have them not fear that if they bring that forward, that they're going to lose their job because you're going to automate it as well.
Well, I don't know about but for me personally, if I'm doing the same thing monotonous over and over and correcting the same problem over and over, to me, that's a definition of insanity, right? Yeah. I want to use my critical thinking skills to do value added work. And that's a part of the culture, is that when you start evaluating and looking at how you're going to change your revenue cycle and you involve employees and get them excited about the changes you're going to make, digital strategy is not a replacement for employees. It's just not. It's really saying we're going to take the monotonous work, the error-prone work, the rule-based work, the things that you're continuously fixing, and we're going to find a new way to do it better and redeploy you in tasks that bring more value to the organization, that leverage your critical thinking. And you have to do, when you're evaluating and creating that digital strategy, you really have to look holistically. It's not just about technology and your complex technology, or you're using it right, or your underused technology or ineffective technology. You have to look at where it makes sense to automate and where it doesn't. You have to look at your reporting, and are you spending an inordinate amount of resources in creating reporting so you know what's going on in the organization because it's not connected to your systems. That's another indicator that you probably need to do something differently. Or an over-reliance on manual processes. Sheila, to your point, that person that's always putting that 25 modifier on it. That means you have a problem somewhere and you haven't automated something that would be easy to automate. So really looking at things that aren't working, where you have limited account visibility, or you haven't done a deep dive and root cause analysis of what's wrong. You have increasing denials, why? Decreasing cash, all of these, and all of this can help you put together a plan of what you need to do digitally, because that is going to be the solution. It's not always going to be more people. It just can't be. We don't have the workforce. We know the workforce shortages, and we do have technology. So we need to know what to do first, when, and why.
Can you hear me better now?
Might have cut out a little bit.
Man, so we're 15 minutes left or so. Let's move to payer management. That's always, when I go to conferences, or when we're trying to build an agenda for a conference, it's always, how do we get the payer and the provider together? So how do we build that communication line between payer and provider? Kari?
You're going to start with me? Well, I think it starts with us as providers. We need to understand our contracts and amendments, not just the CFO, not just the VP of payer strategy, but the VP of revenue cycle. We all need to know and understand our contracts and the amendments. And then we also need to understand our data. What is our data telling us? We need to create payer report cards that trend our challenges, our time to pay, for instance, our collection challenges, our denial write-offs as a percentage of net patient revenue, the time to appeal, all of those things we need to be tracking and understand it and have done a root cause analysis of it so that we can then meet with our payers to resolve the challenges. if any of you aren't meeting with your payers, which I expect most of you are, I think that having strong payer report cards is essential. And HFMA does have a standard set of KPIs, I think, that will help you track your claim integrity issues. But the bottom line is that you have to know your data, know your contracts, and meet regularly with your payers to develop that relationship on, you know, how to fix things. And when you aren't getting any action out of that, you need to escalate it up the chain of command. You can't just sit on the same issue month after month after month. So those are some of the things I think we need to do with our payers.
Sheila, any additional?
Yeah. You know, from a revenue cycle standpoint, I want to agree with Kari on the fact that revenue cycle really does need to be involved with understanding the contracts and amendments, because they can provide information back to payer relations, payer strategy, you know, on the things that we're seeing, and maybe ask the next time that there's a new amendment. You know, the payers have a wish list. They want to reduce their reimbursement. Well, we have a wish list too. Give them your wish list. You know, maybe they have to pay us within 7 days. That would be great, but we all know that's not realistic. And definitely being able to communicate back to the payers. Regular meetings are super important. I think it's very important to understand you can agree to disagree. I will just share, you know, one of my favorite payers over the years to work with is United Healthcare. And we can all laugh because they're United Healthcare. But we had a good enough relationship that you would see things get resolved. Yet, unfortunately, when something get resolved, something else would break too. And that is what it is. But being able to have that open dialogue and be able to share, and to Kari's point, being able to give them realistic data too. It's no different if they were to walk in our door and say we were causing all these issues. Well, if they didn't do their research, how do we fix our issues, and vice versa?
This is I'm the layman here. I'm the consumer. How often and how willing are the payers willing to sit down with you to have those discussions?
Well, they have a division set up to do this. So, you know, it's you setting the expectation with your payer and then following through. Like, I can tell you one place that I work where, you know, what we had ongoing payer relation meetings, but they weren't effective. And as soon as, and the payer knew it, but that's okay with them, you know, that's fine. It's really up to the leadership to make sure that you have effective payer meetings and that you're including the right people on the team, that the decision makers, someone from managed care, someone from the revenue cycle, you might even have a clinician on your meeting to talk about issues. And then the payer, the payers are willing to work with us. We just have to show them we're serious about this business.
Yeah, well, you know, and I think both parties probably feel like they have leverage in some form, right? But so another question, denials are on the rise. How does a provider work with the payer to reduce that burden? And, you know, I can go all over the board with this, but denials, it seems like they escalate. They go denials on this segment, denials on this one gets fixed. How do you work with that payer to reduce the burden of denials that you're seeing at the hospitals?
I mean, I think it goes back to Kari's point of providing payer report cards back to them. You know, it's, what is it doing for us? What do they deny everything? And I had a payer who rejected claims, didn't let them in their door, and would send you a piece of paper letter to let you know that they denied it. Well, let's talk about COVID when no one's here opening the mail. And so all these claims are denying. So being able to give that information back to them, what is it causing you? And being able to trend, I think Kari talked about that earlier, being able to trend your denials as well. So is it authorization? Is it experimental? Is it not medically necessary? Because you have to be able to figure out where in your system you can prevent some of that information. And keeping up with the payers and their requirements and guidelines can be a full-time job. And then going back to rebuild your system, yet to flag these orderables that they need an authorization or anything like that.
You know, denials can be internal and external. They can be caused by the payer, but they can be internal too. And if you don't know what's causing your denials and then you fix your internal issues, then and you're really only giving your payer the issues that they're causing, I think that will help improve the communication process and the timeliness of response from the payer. So, there is a shared responsibility there. Unfortunately, we have things that occur within our own organizations that cause denials as well, and we need to acknowledge that and fix it.
Valid point, valid point. Well, let's transition to a couple of these other last remaining in the time we have left. But, cash is king, and that's been a saying since I got into business 34 years ago. Talk to me about, Kari, you start this out with, how do you view cash is king? How are you monitoring that and managing that?
Well, I think obviously Sheila and I are going to come together. We're going to create a standard set of KPIs that monitor the revenue cycle, and we're going to use those to drive performance improvement, and we'll measure and adjust them as needed. But you've got to be able to trend your outcomes within the revenue cycle and trend them to national best practice standards. Again, HFMA has key as KPIs that they recommend. And if you aren't trending it, you can't improve it, right? So that's the bottom line. Sheila, you said you guys aren't doing anything to incentivize and pay quarterly bonuses or anything like that, right?
Right, from a staffing perspective.
But that's another thing, is when you're really looking to drive cash, you've got to make sure that you have clear cash collection goals for each of the areas within the revenue cycle, and the employees that are in those areas are trained and regarding what the expectations are and how they perform with generating cash, whether it's collections on the front end that start with financial counseling and then knowing their deductibles, their copays, and collecting those on the front end all the way through. You've got to invest in on-site collections and how to collect cash. You've got to teach your team how to compassionately do it. I think that will drive cash as well. But to me, KPIs are the most effective way to really have insight into the organization and the opportunities to continuously increase cash, and to make sure that those KPIs are truly reflective of what's going on. Our cash goals can be impacted by how finance is defining revenue recognition too. So it's not just a revenue cycle task, right? You've got to have the finance department, revenue cycle, and managed care really in knowing and understanding the contracts, what's the expected payment, and driving all of your KPIs from that information. I guess if I were to say one thing about the conversation today, revenue cycle is a team sport. So it takes all of us.
Yeah.
Yeah, I think from a CFO perspective, a lot of conversations I have in my daily work business is cost to collect, right? And then when we talk about cost to collect, it's, okay, where do I draw that line internally of what I keep my team focused on, and what do I outsource? Sheila, any comment regarding that?
There's many reasons, I guess, in my opinion, at a director level, to outsource and then keep in-source. There's a lot of times where with staffing shortages, you maybe just have a project and you need to get cash in the door and collect it, or it's just going to sit and get essentially worse, and we're not going to have any money. So bringing somebody in to do special projects as needed, I have a perfect view on that. I think it's absolutely acceptable. Kari, I'd probably think of more after you speak.
Well, I think that outsourcing is just part of our industry today. And I have an appreciation for our vendor partners that bring resources to the table that as a CFO, as a VP of revenue cycle, I can't do. I don't have the staff, the technology, or the resources, or maybe even the knowledge to do everything that our outsourced partners can do. And that there's nothing wrong with that. That's okay. I think, you need to identify what you do well and what you don't do well. And what you don't do well in your, look at your digital strategy again and say, is this an opportunity for me to outsource to a partner that does this really well and they do it in 100 hospitals, 200 hospitals, whereas, you know, it's just me, myself, and I'm not going to get where I need to be. So I think outsourcing is absolutely important. I attended a class conference last fall, and, you know, talking about, you know, what should we outsource and why should we outsource? And I've worked in organizations where you have best of breeds and you're trying to piece it all together and come up with, you know, a really good system, but then you have the interoperability challenges, et cetera. And one of the things that I see the industry really moving toward is identifying vendors who do multiple types of outsourcing and strategies and built-ons. And so you're really not going after 10 different vendors. You're really looking at, you know, one vendor that can do most of what you need. So again, going back to your digital strategy, what's most important and who can best meet those needs. So yeah, I think outsourcing is important to a revenue cycle, especially.
Take care.
Thank you.
Thank you, everybody. Have a great day.
Take care. Bye-bye.